this is submission number 9833. My name is Hillary, and I've been working with Professor Masaru Yarime on an understanding the life cycle of generative artificial intelligence in industrial settings, specifically within the financial services and healthcare sectors. From our findings, we seek to understand the implications for governing risk and responsibilities among different stakeholders. And we are with the Division of Public Policy at the Hong Kong University of Science and Technology. Just jumping right into it, a brief outline of our presentation would talk about the context of GenAI in commercial settings and why this research is important. Next, we'll talk about our research questions and the methodology that we used. Thereafter, we'll go into our findings and implications for policymakers, and different stakeholders. So jumping right into it again, in 2022, we saw US 85 billion of private investments going into AI. So we're interested to see how AI and scoping it down, Gen AI has been used in industrial context. And we observe a lot of sector-specific studies in healthcare, financial services, cybersecurity. But we noticed that there wasn't a study that approached Gen AI adoption or risk management and considerations from a cross-sectoral lens. This is important because when we look at innovation systems, each innovation system, such as healthcare and finance, has very different actors, networks, and institutions and interactions between. They also operate in very distinct regulatory frameworks and environments. So let's say taking for finance and healthcare, for example, their core functions are inherently different. So finance focuses on business impact and improving your rate of investments or ROIs. Healthcare instead emphasizes on accurate diagnosis and personalized treatment. And when it comes to the blocking and policy issues, these two innovation systems also conceptualize key uncertainties and risk very differently. So finance focuses on maintaining market stability, and healthcare emphasizes patient care and the safety of medical devices. So these inherent differences within innovation systems would imply that GenAI adoption would also incur kind of different uncertainties, risk, and different measures for each sector. And it's important to have that cross-sectoral lens for policymakers to understand how to manage each innovation system. Moving on into the regulatory levers that we have for AI governance currently. So what we did was categorize them based on their upstream or downstream approach, and if it was rule-based or principle-based. So a key difference between rule-based and principle-based is its binding legislation. So rule-based is regulatory standards or legal obligations a firm, model developers, or providers have to follow. Principle-based approach is more of ethical guidelines and frameworks, so more best practices for model developers or providers to follow as well. So that's the upstream section. So moving on to the downstream section, it's more about model deployers and how rule-based and principle-based approaches are applied to sort of your end use of these AI/Gen AI technologies. So just providing some examples for rule-based approaches. We can see standards and access control legislation, such as your EU AI Act or your CAC's measure for Gen AI services. We also observe sector-specific regulatory requirements. So for example, if you want to take an AI-driven trading product, you do have to go to market. You have to seek approval from the Securities and Future Commission before it can go to market. Similarly, with healthcare, AI ML-enabled medical devices require approval from the relevant health authorities before you can hit the market for consumers as well. So when you're looking at the downstream, so your end use model regulation, we also see that there's actually current regulatory structures for data governance, data privacy, and data protection, and these come in the forms of the relevant laws of data localization and residency as well. We also see some disclosure agreements if Gen AI or AI is used using your consumer information or has been used in the product or service. So these come in the form of consumer protection laws or the right to withdraw from a service if they notice that they don't want their data to be used to feed into the training model. And in terms of the use of ownership and generated content, we see some kind of infrastructure being developed as well, regulatory infrastructure developed. So in terms of copyright infringements and your intellectual property rights. Yeah, so these are some of the rule-based approaches that we have seen. Going down to the principle-based approaches, as shared, these are ethical principles, and a good example is your OECD AI principles. So they're high-level principles that sort of dictate the best practices or considerations that you should have for model development and when you're building your model architecture as well. So the downstream is a little bit more informal for principle-based approaches. So the first layer is actually looking at human oversight. So keeping human in the loop when GenAI outputs or AI outputs are used in especially high critical applications. And we'll explore a little bit more what we mean by critical applications in our case studies for healthcare and finance. Next, there's actually general ethical guidance for professional codes or ethical codes within each the financial services and healthcare industry. So in financial services, it's on a broader term, you can look at it from how corporate values, professional ethics, and business ethics comes into play as internal or within an organization guiding mechanisms when they make decisions when considering ethical considerations. In healthcare, we have medical ethics, and it's applied in clinical settings. So how you do no harm to a patient and make sure those are applied in your professional fields as well. So these are some of the principle-based approaches that we've seen. So this has sort of led us to our research questions, right? So firstly, we're interested to understand how finance and healthcare institutions develop or deploy GenAI. What are the sector-specific risks, and if this adoption has actually caused some disruption in the regulatory infrastructure? So what this means is our current upstream, downstream, rule-based or principle-based approaches sufficient or enough to help these different innovation systems manage the new risk of GenAI? The second research question looks at how ethical codes have been adopted and practiced in the finance and healthcare institutions. So we're interested to see how these high-level principles are actually understood at a sectoral level and by the model developers and the practitioners within those sectors, and to see if there is any gaps or discrepancies in how it's understood at a high level versus at the industrial and sectoral level. So we use semi-structured interviews with industry experts, and we combined it with a use case approach. So we identify areas and examples for GenAI within the finance and healthcare sector, and we interview the key stakeholders, so developers, consultants, and your actual healthcare and financial services professionals. We interviewed a total of 37 industry professionals, and it's a good mix across both financial services and healthcare. Again, we also did interview governments and research institutions and consultants, and technology developers as well. So it provides a good view of the whole ecosystem. Just keep in mind that our interviews actually, interviewees reside more from Singapore and Hong Kong. So these findings might be a little bit more relevant for the APAC region. Going into the use cases, we see across financial services and healthcare, we see very general use cases across both. So what these are focuses on are process and productivity improvements. So for finance, it's like co-pilots and your meeting transcriptions. For healthcare, it helps streamline your clinical note-taking. So going down into the sector-specific use cases, we actually see in financial services document summarization for financial news and daily market conditions, or algorithmic trading used powered by AI or GenAI. In healthcare, we see it in pharmaceuticals as well for drug discovery and drug repurposing. And we also see it to support predictive analytics from different test results or radiology reports. It's also used in mental health support, so to help direct the patients based on their clinical assessments on which resources would be most adequate or suitable for them. So these are some of the use cases we've seen across. Now just going straight into it. This is the kind of the GenAI ecosystem that we have developed based on our findings and some desktop research as well. So looking at in the financial services, you can see the green represents the software section of the ecosystem, and the blue represents the hardware ecosystem, the hardware section of the ecosystem. And from what we see at financial services, financial institutions, or FIs in short, tend to prefer they do develop solutions in-house. So what this means is they'll take open source models and fine tune it based on the parameters that they're interested in. or a lot of them actually do take the end-to-end applications and they take the API calling route with third-party developers or model owners. And we'll explain a little bit why they make these decisions later in the next slide when we talk about the uncertainties and risk. Um, we also wanted to see where the data flows are. So the arrows actually indicate the data flows. And we see that the data flows between FIs and third-party organizations are more stronger because that's kind of the pathway they do take to develop these GenAI solutions for adoption. We're also curious to see if there are data sharing between financial institutions, because when we talk about data and we talk about model development, we think that the more data you have, the sharper your model could be in terms of performance or accuracy. Um, so that was what we're looking at, but data in financial institutions remains proprietary. So there's no occurrence of data sharing between financial institutions. And we go back down to looking at the deployment stage of the ecosystem. GenAI applications remain largely for internal use and internal end use. And we'll also explore a little bit in the next slide as well why these is the case. So in terms of uncertainties and risks for finance, the concerns actually are twofold. The first part is actually on the technical concerns, and they're more focused on the performance and explainability section of GenAI models and adoption. So performance means how your generated outputs and your GenAI trading bots actually perform as compared to human traders. And from the interviews, the feedback was that the performance of the AI and GenAI training bots are not there yet. So there is actually um it's very hard to sort of bring it to market and go to your regulators to get it approved. Another section is on explainability. Mostly what this means for financial services is because these firms are actually accountable to both your shareholders, your clients, your customers, and your regulators. So in terms of, let's say, when loan approvals are used by using GenAI, and two people with similar backgrounds get two very different outcomes in their loan approval request. They'll go back to the firm, and the firm does have to explain why this decision was made. Um, Again, this is similar to regulators in terms of compliance on how the firm has been running their financial services activities as well. The next concern and uncertainty area for financial institutions is actually on the regulatory side. So one pillar of it is actually on cybersecurity and data protection. So I will say later as well on the jailbreaking vulnerabilities and the data poisoning attack concerns. For those doing off-premise deployments, FIs also remain concerns about data leakages. So they do try to reduce the nature of sensitive data that's going out from their servers to an external environment. Um, and largely, I think that financial institutions also kind of face this ambiguity around the boundaries of use for GenAI in finance. So for financial institutions' point of view, they don't want to overinvest in developing products that would not be compliant in the future in terms of short term and long term. So there is some kind of hesitancy in actually investing a little bit more to develop number one, external use cases because of these data protection concerns and these regulatory concerns as well. So this is from an interviewee, and what they mention is there are some technical concerns around explainability and hallucination, but primarily the reason why they haven't have an external facing kind of GenAI model that the public can interact with is because they're concerned with adversarial prompting. And having it exposed to the public, you can't really control the risk around how the public interacts with your LLM models. So that's a risk that they cannot manage. So they do not have any external facing LLMs at the moment. And in terms of again working with clients, this is another interviewee that does digital innovation in a bank. And what they say is that they don't want to place clients directly when they're interacting with the model, especially when there's some financial implications, because the current regulatory landscape is still evolving and they're not really sure what kind of things are within the legal bounds of use or legal bounds of advice. So it's a risk that they're not willing to take. And regulatory non-compliance could be really severe in this case as well, and reputational damage and risk. So how they've been managing these kind of concerns in the short term is for the technical aspects. There's been there's internal testing of these models. So before any of these models are used or deployed, there's some of internal testing. In terms of the regulatory side, we actually see that all of financial institutions have their own review committees that oversee the approval of GenAI projects. Some firms also do have committees that consider its responsible use or its impact on job displacement. So these are some risk management mechanisms in place. And again, when it comes to the higher risk use cases, so when you're interacting with clients or providing financial advice, they have tried to keep the human in the loop. So for example, summarization of daily market reports for investor use. So there'll be this investor relationship manager going through the outputs and just giving it a green light before it goes out to your clients or your stock traders. And when we think about ethics, it's a really interesting part for financial institutions. So when you speak to those in senior management and your AI experts in these institutions, they think that AI ethics should be one and the same and reflect your company values. And when you match company values with the business impact, you can sort of create this space for responsible and Gen AI development for these financial institutions. But the reality is your technology teams, they're actually more focused on creating a minimal viable product or generate a positive ROI for this project. And considering these AI ethics, let alone corporate values, has been something relatively new to them in the product design lifecycle. And it's really hard to actually meet that middle point between business impact and company values. So this is an interview from a technology developer in a bank. What they say is that essentially they don't recall any episode that they talk about ethics when discussing about technology. But because of Gen AI, if you don't have these ethical elements and considerations, you're leaving a big loophole for people to exploit and essentially bring sort of reputational harm to your bank itself as well. And when you talk to the responsible AI advisors, they understand that ethics and business impact should go in line when you're developing a product or developing a solution. But sometimes they understand that it could be competing. And again, there's no clear way on how to resolve this for now. And it's still a current ongoing struggle between establishing ethical practices and while driving business impact for Gen AI adoption. And this is another interviewee sharing that they should consider ethical aspects of AI as part of the business ethics. But again, we have seen, well, on a strategy level, this makes sense to have synergies between, but on an implementation level for your technology teams, we're still not really clear on what this means and how it fits in the product development lifecycle. So going on into healthcare, we can see the ecosystem largely remains the same in terms of its software and hardware sections. A point to note is that healthcare institutions tend to develop their solutions in-house, so they prefer that open source fine-tuning route. We don't see end-to-end plugin applications, and we rarely see when they're drawing on APIs from your third-party solution providers, and we'll share a little bit more on why later about because of its uncertainties and risk. We also see partnerships with a little bit more partnerships with academic and government institutions. In terms of data flows, data remains largely within the healthcare institution, mostly because of its sensitivity. In terms of data sharing, it also remains limited to the healthcare institution. And yeah, in terms of deployment, we see both internal and external end users. However, I think a distinguishing point for healthcare here is that for external use cases, it's been actually used more from the clinician's point of view. We don't see much use cases that involve direct patient interaction. And in part, these are due to the uncertainties and risk of Gen AI adoption in healthcare. So the technical aspect remains a similar concern for healthcare professionals, but they are more concerned about the accuracy and robustness of the model. So we'll discuss a little bit about accuracy and how it sort of this generator outputs match with the desired outputs or the actual outputs that it should be giving. In terms of robustness, EHR or electronic health record data and radiology reports are usually never consistent. So for the model, it does have to perform well in both these in different scenarios and different structures of data to get similar outputs as well. A next point of uncertainty is actually on the data side. So data availability, sharing, and protection. We've seen EHR data contain sensitive information, and sometimes hospitals that own these data might not have the current technical capabilities for model development. And we see kind of a struggle in actually getting this data when your academic institutions are partnering with your hospitals to get approvals is a really long process, and sometimes not the full data set can be actually received from the hospital as well. So going on into the last part of uncertainty, it's actually more of a long-term concern. So, and it actually sort of structures how and GenAI has been used in the sector. So healthcare remains really patient-centric, and they focus more on patient preferences as well. So clinicians remain at the primary contact points, and this has sort of fit GenAI in more assistive or supportive role for the clinician instead of the patient as well. So that could be one reason why we see more internal and clinical support use cases as compared to patient-facing use cases as well. This is an excerpt from a healthcare practitioner. So he talks about accuracy in a few different layers. So the first part of accuracy is the technical aspect, when your accuracy between the outputs match with the actual medical prescriptions in the EHR records. The second layer of accuracy is on the professional level. So it's on how the output generated actually matches or syncs up with the medical prescriptions from different individual doctors. And the third and the most challenging layer of accuracy is actually how these generated outputs align with like the gold standard for medical prescriptions. So this is some how ways healthcare professionals have been thinking about accuracy. Again, this is a medical researcher at a firm that provides solutions for healthcare institutions. And when we ask about data, they do see the great value of data, but hospital systems are not necessarily designed to promote data sharing within or across systems, mostly because sometimes they use different EHR systems or the infrastructure is not compatible and it makes data sharing significantly harder than it should be. And again, this is from a digital transformation manager in a hospital. But what they mentioned was actually how healthcare is still very patient-centric and where physical engagement between clinicians and patients are often much preferred. So you can see how it sort of shifts where the attention or possibilities for the use cases have been developed for. So it's more clinical support, more supportive for the clinician instead of more for patient-centric uses. And healthcare has been managing these risks. Similarly, with the technical concerns, there's internal testing done for these models. But for both healthcare and financial institutions, these tests that they do run are not really opaque to those with outside the organization. So we don't really know what model test they're running and if it's synonymous across the industry or use cases. And for the regulatory kind of concerns around data and patient centricity, currently, the hospitals and healthcare professionals do have to comply with existing data privacy and protection when using GenAI models. So the current risk management of data leakages is there. And again, they have to have data localization when sensitive to store sensitive information. Again, the deployments at pilots have been really focused on clinical for clinicians, and it's been rarely tested in small group scenarios with patients as well. So that's kind of how they manage a little bit more of that patient-centric risk that we were concerned about for healthcare adoption. Yeah, so going on to the ethics part, so it's really interesting because healthcare practitioners mentioned that they conceptualize and implement ethics for GenAI should actually remain consistent with current medical ethics. However, the bridge between medical ethics for GenAI and its practice still remains a bit unclear. So how it's actually done on both at an upstream and downstream level. That the upstream level is a bit unclear, but at the downstream level, you can see how as the clinician makes the final decision, it does run through these ethical filters for, let's say, benefits or respect for autonomy and patient rights as well. But at the upstream level, we don't really know how it's sort of built into model development. And that could be an area that research could sort of explore a little bit more on how ethical considerations are conceptualized upstream. This is a quote from a healthcare practitioner. So they mentioned that when it comes to AI ethics, it shouldn't be any different from any form of healthcare ethics. Again, they view that healthcare professionals are stewards of the patient's data and they should try their best to use it to provide better care for their patients. Um, and in terms of this is a product owner from Mental Health Chatbot, and what they mentioned is that because of the sensitivities, they are resources. They try not to do any harm, and that should be the baseline of every healthcare resource. And we're not sure if this is actually applied at the upstream level in terms of the model development as well. What we're seeing is more model deployment and use of ethics in medical ethics. So just quickly moving on into some of the policy implications because of these characteristics that we observe. So for financial services, because of the outsourcing and more commonly using third-party solutions, it'll be useful to review downstream regulations such as data governance or regulatory requirements for financial model training. So it's just to see because of these new third-party actors involved, if there are any gaps within the current risk management and data governance practices that should be addressed to prevent any severe crises of data leakages and data governance non-compliance. Also, we kind of have a baseline understanding on how to address some of the technical uncertainties. Financial institutions do have that knowledge, but the regulatory uncertainty around the bounds of use has actually sort of left FIs a little bit more conservative when developing GenAI solutions. So from the policy standpoint, it would be useful to consider regulatory sandboxes to support firms in addressing these regulatory and legal complexities, and they can sort of develop their solutions in a very regulatory kind of clear regulatory parameters. There are current regulatory sandboxes in play. So Hong Kong's Monetary Authority has proposed a regulatory sandbox for banking. Singapore also has their sandbox for SMEs to trial their solutions for. And this could be a possible way to help the financial services sector develop more develop GenAI solutions. We also see a challenge in integrating ethical codes or corporate values while creating business values. So I think what policy can sort of help to step in here is actually establish a sectoral specific ethical code for FIs that governs the GenAI use and provide, I think, specific details and steps on how it can be implemented in business practices because the structure is kind of not present or I think less commonly discussed within the financial services ecosystem. For healthcare, based on the use cases, there have been sort of limited to medical research and shy away a little bit from clinical applications because of some of the technical concerns the model has. So it would be useful for policy to sort of help with establishing a shared understanding or golden standard testing toolkit for each practicing field to ensure some harmonization in how the models are evaluated and to make sure that regulatory bodies have sight of how models are being tested and validated. Again, to prepare for clinical applications and patient use, it also will be useful to get a head start to review upstream regulations such as your AI, ML enabled medical devices. And in the context of GenAI deployment, does it change these current requirements or do we just need to add on different additional layers for risk management and protection for in the deployment and for consumers as well? Again, data availability, sharing protection concerns, having key concerns for healthcare as well. It might be useful to help fast track certain collaboration pathways where data sharing. So when there is like high potential for improving healthcare effectiveness, or there's ways to get around using synthetic data as substitutes before a final version of the model could be used to train with the actual data. And the last point is actually for medical ethics, we see that it's actually guided the downstream use of GenAI in healthcare. So in terms of when clinicians are interacting with the model, medical ethics does guide them there. But at an upstream level, in terms of model development, we're not really sure how medical ethics are sort of built into these considerations for the model So it would be useful to establish an upstream consensus for medical ethics, also guides the model development process. Now going into our summary, so from our observations for both financial services and healthcare, in the use case development for finance, we actually see it's been limited for internal processes and shying away from external use, or that means client-facing or public-facing use. For healthcare, we kind of see a similar trend. It's actually been limited to medical research and led away from clinical applications or patient-centered use. And this is in part because of some of the uncertainties and risk both sectors have faced. So for financial services, the technical uncertainties around the model performance and explainability and the regulatory uncertainty in the landscape actually has left firms a little bit more hesitant to develop their solutions in GenAI. Um, and for healthcare, similarly, we see technical concerns, but more focused around accuracy and robustness. Again, data protection remains for their patients remain a priority for these healthcare institutions. And in part, these uncertainties and risk have actually sort of nudged how use case development has been done in both financial services and healthcare sector. In the ecosystem in finance, we actually see more prevalent outsourcing and use of third-party solutions. But in healthcare, we see more in-house development or partnerships with academic institutions to develop these GenAI solutions. And in terms of ethical principles for finance services, we noticed that they're still relatively new in understanding how to integrate ethical codes, your corporate codes and values, while creating business value simultaneously. For healthcare, they're a little bit further ahead. A lot of their downstream Gen AI use has actually been informed by medical ethics. Um, and these lead us to our policy implications as well, as previously discussed. So because of the unique nature of the use case development, uncertainty and risk ecosystem, and the ethical principles, these are some of the policy implications that our research has proposed. So for financial services, because of its unique case development and its technical concerns around model performance explainability and regulatory uncertainty, we propose to leverage on regulatory sandboxes so that it helps firms address that regulatory and legal complexities around GenAI adoption. For healthcare, because of its current challenges in accuracy, robustness, um, we propose to have a shared understanding of develop a gold standard testing toolkit so that those in the fields of practice can have sort of a baseline understanding of how their models react to the industry standard per se. Also to prepare for patient-centered use, we also propose to review upstream regulations such as your AI ML and enabled medical devices so that the regulation is much more ready when there's patient-centered use cases for Gen AI wanting to go to market. In terms of the ecosystem, because of financial services outsourcing and third-party involvement, we propose to actually review downstream regulation like data governance practices or risk management practices, so that we can actually understand if GenAI actually changes any of these changes or introduces new gaps to current risk management practices and how we can sort of build upon them to make these current mechanisms more robust to handle GenAI adoption in these financial service institutions. For healthcare, we noticed that data protection remains really high and the sensitivity of electronic health records is a priority. So to actually help, and hospitals sit on a lot of rich data, so to help these hospitals develop and share data with probably academic institutions or other institutions who have the technical capabilities to bring more solutions on board. We propose to establish fast-track collaboration pathways for data sharing with these identified effective healthcare use cases for effective healthcare delivery. In terms of ethical principles, because of the financial services kind of a newness towards considering ethical principles with their development of technologies, we propose to establish a sector-specific ethical code that's understood through all stakeholders, so that there is a common understanding on what are the ethical thinkings guiding the sector and what are the implementable or actionable items that each institution can follow thereafter. For healthcare, we see a very good downstream implementation of medical ethics when GenAI is sort of used to make decisions in impacting your patients. but it'll be also useful to establish an upstream consensus where medical ethics also guides the model development process, because we see less of that currently in our discussions as well. And that should be my last slide. So thank you for listening. And here are the references.